Hi, everybody. It's State Senator Mallory McMorrow. Welcome to a new year, 2022, and This Week with Mallory, now at our new time, Fridays at 10 a.m. So we are so glad that you could join us, and we're going to go ahead and get into it. Hi, everybody. This week, we are starting off with a special guest. It is hard to believe that we are now going into year 3 of the COVID-19 pandemic. We know a lot of people are tired and stressed out and exhausted, but the reality is no matter how tired we are, this virus is still with us. So we wanted to talk to an expert right here in our community. So I'm going to bring on Dr. Sims, an infectious disease expert at Beaumont. Dr. Sims, thank you so much for joining us today.
You're very welcome.
So I am just going to jump right into it. Now that we are in the throes of the Omicron variant, can you tell us what you're seeing that is different about the Omicron variant versus previous variants that we've seen of COVID-19?
Yeah, so the Omicron variant is much more contagious. That's the first thing to know. It seemed, in the original strains of the vaccine, it really took about 15 minutes of exposure to get infected. With Omicron, it seems almost any exposure will get you infected. So it's spreading much faster. And, the original strain, then we went to Alpha, which was about twice as contagious, and then Delta was about twice as contagious as Alpha, and Omicron seems to be about 4 times as contagious as Delta was. So much more contagious. But on the other side, it also doesn't seem to make people quite as sick. Now, even if it only makes people half as sick, if there's 4 times as many people, you still have twice as many who end up needing to go to the hospital. So it's
yeah.
It's
so
still
can
pretty
you
bad.
elaborate a little bit? Because I think that is where I know a lot of people are asking a lot of questions, right? If this is less likely to cause serious illness, can you talk a little bit about who you're seeing right now in the hospital? Who is getting hospitalized, ending up on a ventilator, and are there any trends that you're seeing?
Yeah, so there's a few things. Number one, we try to distinguish between admitted to the hospital for COVID and admitted to the hospital with COVID. Because this is such a milder illness to some people, especially vaccinated people, a lot of people are coming in for other reasons. They got in a car accident, they have appendicitis, it could be almost anything. But we test everybody because we need to put anybody who has COVID in isolation so they don't spread it through the hospital. So we have a lot of people who come in for another reason and just incidentally test positive for COVID. But out of the people who are coming in for COVID, they are getting sick. They do need oxygen. Some of them end up on the ventilator, as you said. More of them are unvaccinated than vaccinated. But when you look at the vaccinated people, 93% of them are unboosted. Right?
Oh,
so the majority are unboosted. So we know that as the variants come out, as you get more and more changes from the wild type, and the vaccine was made against the wild type. So as you get more and more changes from the wild type, the vaccine doesn't match as well. So when if in the original vaccine, 100% of the antibodies you made matched, and then as you got to Delta, maybe it was only 75 match. Now as we get to Omicron, maybe only 30% match. So you really have to boost the level of the ones that match up higher in order to get the same level of protection. So that's, I think, why we're seeing that. It's really even among the vaccinated, it's the unboosted people who are primarily ending up in the hospital.
So I think that opens up a question. And we saw data a couple of weeks ago that a record number of kids in the state of Michigan were hospitalized with COVID. I'm a parent of a almost 1-year-old. And I know, I'm in a group of a lot of people who are anxious about this. So can you
Sure.
talk about, for people who have kids under the age of 5 who can't get vaccinated yet, what advice do you have? And what are you seeing, if there are any kids in Beaumont who have been hospitalized? Are there pre-existing conditions, comorbidities to watch out for? And just what general advice do you have for parents of kids?
Yeah, I mean, obviously, the same sort of comorbidities that we worry about in adults, we do have to a certain extent, worry about in kids, especially immunosuppression, people who just can't mount a response to a vaccine or to an infection. Um, we're still not seeing a tremendous number of kids in the hospital. But, again, as it's more contagious, we're going to see more in general. Um, Kids tend to not get as sick, but with Omicron, there do seem to be a little bit more who are getting sick. What I would tell parents, I have 2 kids. They're both school age. They're both in school. They're both fully vaccinated. My 13-year-old, almost 14 now, she was one of the first 2 kids vaccinated by Beaumont. Got to, stand in front of the reporters like I do and talk about the experience. Um, and uh, and she's she's going to get boosted very soon. Actually, we had to have an appointment for that. My youngest is 11, and so she was in the first group of kids vaccinated by Beaumont in that age group. Um, and so she doesn't need a booster yet, but when it's time, we're going to get her a booster. So I'm a firm believer in vaccinating kids for this. I vaccinated my kids, no hesitation whatsoever. Like I said, they were in the first groups. In fact, we even looked at trying to get them into the studies.
Oh, wow.
But they just weren't any pediatric ones near here.
Yeah.
Now, what do you do when your kids are too young? Well, kids 2 and up can wear masks. That'll help, prevent the spread. And it's really about trying to keep them out of situations that it might spread. Now that's difficult, right? Daycare and, play dates, and you want your kids to develop socially. So it's difficult. So I would say keep them as healthy as possible, get them their other vaccines that they should be getting, flu shots, things like that. Make sure they get rest, make sure they have good nutrition, make sure, all the normal things about keeping your kids healthy. And you do your best to not let them get exposed to COVID. So
That's good advice. Yeah, I know it's not easy. We're all working through it. So I know a lot of people have had questions about revised guidance from the CDC on isolation, especially with Omicron. I think we've all heard at this point everybody's going to be exposed. A lot more people are getting it. Can you talk a little bit about that?
Yeah, so there's a few things. So there's what the CDC said, and there's what everybody hears, right? So everybody hears it's down to 5 days, but it's not quite that simple, right? So it used to be 14 days, and it was 10, now it's 5. But it's not 5, it's not just 5 days, right? At the end of the 5 days, your symptoms have to have gone away. You have to have no fever without taking Tylenol or Motrin or anything to get rid of the fever. If at that point you have no symptoms, etc., then the next 5 days you have to obey strict masking with a well-fitting mask, right? And that doesn't mean, oh, you can go to a restaurant and take your mask down. It means that you always have to be wearing your mask 100% of the time where you're exposed to people. And that's because the data shows that at 5 days, most people are not contagious anymore, but 30% can be, right? And then when you get to 10 days, it's much fewer that can still be. Now, again, that's if you have mild to moderate COVID. If you have severe COVID, then that changes, right? The days go longer. The period of isolation. In the hospital, if people have severe COVID, we isolate them for 20 days.
Got it. So what you're seeing is confirming, because I think some people are like, oh, is the CDC just changing guidelines because people want to go back to restaurants, right? Is there kind of political pressure to change that? But what you're saying is you're actually seeing most people are not contagious after that 5-day window.
Right. And that's a big thing. And that second 5 days with the strict masking, people sort of omit that when they talk about it. They say,
Yeah.
oh, it's 5 days isolation, but it's followed by 5 days of strict masking. And there's a few reasons for that. It's not political, but there is a recognition that the workforce is being tremendously affected by this, and that
Yep.
we think that we can safely deal with that. And there's a recognition that a large number of people who were being told to isolate for 10 days before just weren't doing it.
Right.
And that's difficult. It's like, how do you deal with that? But one way is to say, okay, you can do this, and this is going to still be safe, but let you get out of the house.
Got it. That makes a lot of sense. All right. So big news was announced this week that anybody can order at-home rapid tests to be delivered.
Yep, we ordered ours.
Website worked. It didn't go down.
Mm-hmm.
Hopefully,
Yeah, we actually went up a day early.
Yeah, it's very rare for things from the government to go up early and work. Can you talk a little bit about the effectiveness of those tests, and why would people use an at-home test versus, going to a testing site, getting a PCR test?
Sure. Well, ease is the first reason, right? Why would you do it? Well, because you have it at home. You don't have to get in your car when you're not feeling well and go somewhere. And that's a big thing. The other thing is we recognize the sheer amount of people that are going to testing centers and not being able, they end up running out of tests for the day, or they just can't get everybody through the line. It's a big issue. So this will help alleviate that. Now, in terms of how good they are, I don't know which test kit is going to be sent to people, and it may differ region to region. It may be that we've got the government got 13 different test kits in, and you're going to get 4 of whichever one is up at that point. Yeah. I don't know the answer to that. And different ones work better or worse, right? Now, hopefully all of the ones that the government is using are among the better tests. But one of the things we've seen with Omicron, so the test is a nasal swab usually, right? So and not a nasopharyngeal, right? So when you get a test at a hospital or whatnot, the PCR test, that's usually a nasopharyngeal swab.
It's like all the way back there.
All the way back, right? As my daughter said when she had to have it, it felt like they were stabbing her brain.
It's an experience.
It is, and as somebody who occasionally does them for people, you're not doing it right if the person is not a little uncomfortable. To put it that way.
Yeah.
Because it really does go all the way back. Now, these kits at home, they're not supposed to go all the way back. They're in the nose, right? The front part of the nose. They're nasal. One of the things about Omicron, one of the symptoms that everybody talks about is it starts out with a scratchy throat frequently. Mm-hmm. And it seems that Omicron really is more in the back of the throat, so more than it is in the nose early on. So one of the things they've learned is sometimes in the first couple of days, these at-home test kits, because they're in the nose only, will be negative, even if the person is positive. And when you only get 4 for your whole household, so if you're a person who lives alone, you get 4. If you're a family of 10, you get 4.
Right.
It's when you've only got so many and you can't retest easily, there's limits. And then the other thing is with the at-home kits, there's no unified way of reporting the results of it in a meaningful way. So that means that when somebody tests positive with an at-home kit and then doesn't follow it up with a PCR somewhere, or if it happens to be one of the kits that has a reporting number, or one of the counties that has a way to report that, because not all do,
right?
Then that we underestimate how much COVID is out there because of these at-home kits.
Well, I think that's a good lead into my next question, because I do want to be optimistic. I don't want to be overly optimistic, but we saw reports out of Macomb, who was doing some sewer testing and saw, I think, not to be overly graphic, but in some fecal matter that the amount of COVID is lowering. Are you seeing in the hospital that, are we near or at a peak of Omicron, and are we hopefully coming down the other side?
Yeah, we're hoping. So what you mentioned, the testing of sewage has been shown in previous spikes to precede the end of the spike, right? As you see less virus in the sewage, you see, the spike starts to end. So we're hoping that that's going to be true here. Um, at Beaumont, we seem to have hit the top of the numbers last week. We hit about 850 admitted patients hospital wide. Then we went down to around 700 and kind of stayed there a bit. And I haven't seen this morning's numbers, but I think it was yesterday's numbers. We dropped about 10% to about 630 admitted. So the numbers do seem to be coming down. It's a little early to say we're out of it. And the other thing I like to point out is, previous surges, so right from the first surge all the way through the third surge, we would be kind of low and then we would surge up really high and then come down really low again. And it may tail off toward the end where you're kind of hovering and hovering and hovering and then you're really low. But, as, we've been going up steadily since early July.
Yeah.
And there's a lot of reasons for that. I think, July 4th was a little piece of it, very small piece of it, to be honest. I think that it was the end of mask mandates, and then the evolution of Delta, because as soon as Delta came around and the vaccinated weren't quite as protected and it's much more contagious than Alpha was, our numbers started going up. And then the schools going back into session, especially schools without mask mandates, and there were clear studies that showed much more COVID circulating in schools without mask mandates than in schools with mask mandates. And then, holidays, cold weather, Omicron. So I don't know that we're going to go way, way, way down the way we did in previous surges. We might. Omicron is potentially changing everything. We just don't know where things are going to end up. Because I don't think we can use the prior surges to predict that because, number one, we weren't surging before Omicron, but we were higher. We were constantly going up. It was more like an upslope than a surge. Number two, then Omicron is so different. So will it, come down and then sort of stay at a higher level here and there? And I don't know. But, we're hoping that Omicron, because it is somewhat milder and more contagious, that it will lead us to endemicity where, it's a virus that's there in the background all the time and we do have to worry about it. We need to vaccinate like flu, but it may not be where it's overwhelming the system the way COVID does.
Well, hopefully that's good news. So I think that is my sort of last question, and then I want to see if there's anybody watching who has a question, and we'll see if we can take any. But so long term, if this is something that is hopefully will become endemic instead of a pandemic, it's just something that we are going to live with, like the flu. Yeah. So what is your recommendation for how do we maintain our normal lives as much as possible as we go through this?
Yeah. So, try to be as normal as possible. I mean, it's pretty much that simple. It's everybody has their own ways of doing it and their own comfort levels. On a personal level, we haven't been to a restaurant around here in forever. But we order out, right? We take out from our favorite restaurants. We try to keep them supported, etc. Now everybody's different, right? So, outdoor restaurants, once the weather warms up, much better to do. Yeah. But what I still say the big issue right now is we still really need to be masking, and we need to use a good quality mask. A lot of the cloth masks, the one layer ones, they really don't do much. And so at least a surgical mask, a KN95, those sort of things that really do stop. The surgical masks will stop people from exhaling the virus onto other people. And so if everybody's wearing one, it's very protective, but it doesn't, if you are wearing a surgical mask in a room with people who have COVID and are not wearing a mask, it's not going to give you that much protection. The KN95s, the N95s, they should give more protection, really protect the person who's wearing it. But they're not as comfortable. The KN95s are fairly comfortable to wear. The N95s, they're hard to wear for a long time. And, speaking as somebody who has to wear them for hours on end when I'm in the hospital, it's not always easy, and if you have a little bit of a stuffy nose that day or a runny nose that day, it's really just can be, problematic. But I think masking is still really important. And, the CDC never, ever said stop masking. They said at one point that vaccinated people could stop masking. But at the time, the vaccine was protecting us against 95%. Right. Because we were in alpha back then. And then as soon as Delta happened, that didn't really hold true anymore, that the vaccine was really protecting people from getting it. Right. It was still protecting people from getting super sick, especially if you were boosted.
Yep.
And that's why we went to boosters. Right? And now, one of the things we're seeing in the hospital, boosters are really important right now, because one of the things we're seeing in the hospital is, yes, we're seeing a fair number of people who are vaccinated admitted to the hospital. But when you look at those vaccinated people, first, it's still less than the unvaccinated. Right? Yeah. We're still seeing way more unvaccinated people admitted to the hospital. And since more people, it's more than half of Michigan are vaccinated now, that tells you that the vaccine is working, at least somewhat. But when you look at the people who are admitted to the hospital who are vaccinated, 93% of them are not boosted.
Wow.
Right?
Okay.
So the booster will help. And so that's the other thing. It's like, you got to get vaccinated, you got to get boosted. That will help everybody get back to normal.
And I would imagine this is your recommendation, but I'm going to ask, would you recommend that everybody who's eligible for a booster go ahead and get one?
Everybody. So my 13-year-old daughter is on schedule to get her booster.
Awesome. All right. Well, I am going to bring on Liz onto the screen. Liz is our Director of Constituent Services, and her title is so long it doesn't fit in the frame. But Liz is going to help us. So what we do is we live stream these, Doctor, across Facebook, YouTube, Twitter, which allows people to ask questions from wherever they are. So Liz is going to moderate. So Liz, do we have any questions related to COVID or for Dr. Sims today?
Yeah, well, we have two questions. One's for you, actually, Tomorrow. Carla on Facebook asked, was your sweet baby COVID positive a few months ago, and how is she doing?
She was. Yeah, my baby got COVID, unfortunately. We shared the story. She had 3 really rough days. And I think the hardest thing, especially for a little one, is we just didn't know how she was going to respond to COVID. So she had a fever, she was throwing up, wasn't sleeping. And then, right after day 3, she woke up and she was back to normal and her happy self, which was good to see. But she is doing very, very well now. And we are being as safe as possible as we can with her. But thanks, Carla, for checking in on her. She's almost 1.
I know, right around the corner.
Left. She's going to be 1 year old. I can't believe it.
Second question is from Joshua on Facebook. They asked, and I think we've already answered this, but I don't think it's a problem to ask it again. Are vaccinated people who test positive no longer contagious after 5 days as long as they think their symptoms are improving?
Again, it's not that none of them are contagious. After 5 days, about 30% are still contagious, which is why after 5 days, everybody still needs to wear masks, because you need to catch that 30%. After 10 days, it's much lower. It's still not 0, but it's to the point where, it's very few.
Awesome. So what I'm hearing is everybody get your booster and mask when you're back out in.
That's it. Social distance, masking, hand hygiene, cough etiquette, stay home when you're sick. It's the same message that, we've been putting out for a long, long time now.
We know how to do this by now. We're all experts, right?
Well, we all should know how to do it by now.
We should.
All right, Liz, any other questions for Dr. Sims before we let him go?
No, those are all the questions that I see.
All right. Well, Liz, I'll let you go for the time being and bring you back a little later. And Dr. Sims, thank you so much for taking time out of your schedule today to talk to us. And
happy to.
Good luck out there. Thank you for everything you and everybody at Beaumont are doing, really.
You're welcome.
Bye.
Bye-bye.
All right. With that, we are going to go ahead and move into our regular run of show agenda for this week. All right. So we are back in session this week. And speaking of COVID-19, you may have heard the news that the House of Representatives, so the other chamber in the legislature, canceled session all of this week because of the spread of COVID-19. And I think that it is just such a reminder to all of us that we know at this point how to stay safe and how to go about our daily lives. We just heard from Dr. Sims how we can do that. Everybody who can get vaccinated, boosted, keep masking up in public spaces when you're around other people, social distance, wash your hands. And that is unfortunately not happening with everybody. So, it is, to me, really, really frustrating. I know that it's frustrating for you. You, as our constituents, expect that your representatives in Lansing are able to do your work and represent you and get budgets passed. And that is really disruptive when that doesn't happen. So beyond that, I have long been advocating for the legislature to be able to adapt to, frankly, where all of you and most private industry and schools are these days, to allow us to continue doing our work remotely. We currently do not have a system that allows the legislature to vote remotely. We have to be there in person. So the House was out, but we were in session this week and didn't really take up or pass any bills. So it was a really, really light session week. A few committees met. So we just wanted to share some updates that the COVID-19 at-home tests are available. I know we posted about this, but we are going to post the link again. So now anybody can get 4 free tests shipped directly to your home. It is 1 kit per household, but you can go ahead to covidtest.gov, I believe is the website, but Liz is going to put the link in just to make sure that I am accurate. Put in your address. It's super easy. My husband did it for our house, and hopefully tests are on their way. We haven't heard news that the website has gone down yet. There were some bugs. Some people reported that if you live in an apartment building, for example, that there wasn't necessarily a place to put your apartment number. We heard that there was a workaround that some people were just typing the apartment number in the address line. So we'll see if that works out. But that's something that we know has been reported back up to the federal government to hopefully tweak the website. But the website did come out a day early, and I know they were doing that for the purpose of testing and getting feedback. So that is up. Go ahead and request your free tests if you haven't done so already. And then there's also the news that your private health insurance, if you do have health insurance coverage, should reimburse you if you do go, let's say, to Rite Aid or Walgreens and buy COVID-19 tests. Check in with your health insurance provider to see what their process is. Some insurers are requiring that you submit receipts for reimbursement, which I know is super annoying, but just go check in. But it's been really helpful for us, like I said, as somebody with a small baby, to just know and have some tests available to us. So when we have had the opportunity to maybe get together with family, we used those at-home tests over the holidays just to know, when we're getting together, particularly with older or immunocompromised family members and loved ones, that we were doing so safely and we weren't putting them at risk. So go ahead and request those tests and stay safe out there. We also just wanted to briefly touch on, it is the 49th anniversary of Roe v. Wade. And particularly this year, when we see reproductive rights and healthcare rights under attack, and the real possibility that the Supreme Court looks posed to overturn Roe v. Wade, which would be the first time in the court's history that they reverse course on what has been determined to be a fundamental right. And this is something we are going to be talking much, much more about. We will be resharing stories that I had shared from people in the community. I think that this abortion is always a touchy issue. And for those of us in these positions, I was advised by people when I first ran and started talking to people, don't talk about things that are divisive. But this is something that is fundamentally important to women, to anybody who can get pregnant and give birth, that we need the ability to decide if and when to get pregnant. It is just fundamental. And forced pregnancy is not a place where we should be. So we will talk much more about this. I am the primary bill sponsor of what is called the Reproductive Health Act here in Michigan, which would codify access to abortion and reproductive health into law. Because right now, if Roe is overturned on the federal level, Michigan immediately reverts back to a law that we have had on the books since the 1930s, which would immediately outlaw abortion and a lot of other things. So there's language in this 1931 law that talks about potions and tinctures and prohibiting people from educating women about these things, which could be perceived and has been warned by some to be perceived as contraception. So it could really set us back here in Michigan in terms of the ability to make decisions about our own bodies, to be safe out there. You know, I have talked very, very candidly about somebody who has used contraception since a very young age to control menstrual cycles, to be able to participate fully in school and work. And that is something I'm very, very grateful for. And we will have a lot more, but it is the 49th anniversary coming up. We will share more about that and what that means. And I would just encourage more of us to talk about this issue, talk about it very openly. You know, 1 in 4 women, 1 in 4, 25% of all women have had an abortion. A lot of these laws would really, really punish women who have miscarriages. A lot of abortions take place within families who already have children and have decided for whatever reason that having more children is not something that they can take on. So, you know, we could talk all day about this issue, and we will be talking certainly much more about it, but it is something that has been decided and upheld by many, many courts over almost 5 decades now as a right. And we are on the precipice of that being overturned. And that is a really, really scary place for us. So we are there is no way ever to do a hard pivot into our good news segment, but that is what we are jumping into because, like I said, it was a light week here in the Capitol. So we are going to go ahead and jump right into good news. So wanted to share 2 choice school student districts have been selected for the U.S. Senate Youth Program. So going up to the big show. That's not that I'm not excited about our position, but this is really exciting. So they were selected among the state's top student leaders for the prestigious United States Senate Youth Program. And they are 2 of 104 scholars from across the country, 2 per state, who will each receive a $10,000 college scholarship for undergraduate study and will join Senators Debbie Stabenow and Gary Peters in representing Michigan during the 60th annual Youth U.S. Senate Group Washington Week, which will be held virtually this year, March 6th through 9th, 2022. So congratulations to Sita and Jayanthi. We're so proud of you for representing all of us here in Michigan. You are the 2 from Michigan, so congratulations. All right, next up on our good news, and Liz is controlling the good news slides today. I was very proud to be a part of this. Royal Oak and Berkeley came together both as cities and as schools. This is a long-standing tradition between our 2 communities here to celebrate and reflect on the life of Dr. Martin Luther King Jr. for MLK Day. And what I have always loved about this event is that this has been called a day on, not a day off. So even though it's a day off from school, Royal Oak schools and Berkeley schools have long partnered to host days of service. I know Troy does this as well. Rochester has been doing similar events, and it's just a really important, particularly now when we're so divided, time to come out. So it was great. I mean, there were hundreds of people who came out in Royal Oak. Knowing that we're still in a situation where we have COVID to deal with. We're not doing as many indoor volunteer events as events have had in the past, but we all gathered, and it was a blistering cold day. So to see hundreds of people come out to Royal Oak Middle School to meet up, where we hosted a donation drive, collecting items like baby supplies, food, cleaning, diapers, for Gleaners and Judsons, among some other organizations, and then joined together in a freedom walk around the city, a mile walking together, just to remind all of us that this is active work. You know, it is choosing to be active participants in acknowledging that racism and racist structures still exist, that there are systemic issues that we need to address in our state, in our country, and right here in our communities, and that we are committed as a community to doing the work that it is going to take to dismantle these systems and make it a more equitable place for us all to live and raise families. So if you haven't seen it already, they put together a really, really wonderful virtual program that is available to watch online. We posted it to our page. Go ahead and check it out on Facebook. And just really kudos to the cities and to the schools for putting together just a wonderful program this year, and for Governor Gretchen Whitmer, who joined us virtually via Zoom to kick off the Freedom Walk. Thanks, Governor, for coming over. And then last but not least this week, look at these trophies. How great are they? All right, Troy Mindstormers team qualifies for the first Lego League World Championships. So awesome. That's so fun. The Mindstormers Lego League team, consisting of students from Bemis and Costello elementary schools in Troy, is heading to the first Lego League World Championships in April. The team, which includes Matthew Gorman, Vivan Shan, Nathan Jung, and Yuriv Alia from Bemis, and Pratyesh, I'm sorry, I'm leaning into my laptop here, and it's far away. Pratyesh Inturi from Costello participated in the qualifier at Bishop Foley High School in November, and they won out over, get this, over 26 other teams to make it to the state championship. The state championship took place at Mason High School near Lansing to qualify for the upcoming World Championship in Houston. I'm so excited. Okay, I don't know if you can see, we have a bunch of Lego stuff floating around the office that we have not put together yet. So congratulations to the Mindstormers. We can't wait to hear how you do at World Championships. And I'm just super jealous of those trophies. Those are super, super cool. All right, that is our good news for the week. So I am going to go ahead and bring Liz back on. Happy New Year, Liz.
Happy New Year.
We are still, I don't care that it's almost the end of January. We're still saying
It's
that.
like it's almost February. Almost happy Groundhog's Day.
But this is our first live stream of the year. So it's still okay to say. All right. So now that we are back into it, for anybody who's joining us for the first time or for anybody who's coming back, this is our live Q&A portion. So no matter what platform you are joining us from, whether you're on YouTube, Twitter, or Facebook, you can go ahead and just type a question into the comment section. We ask that you include your name, what city you live in, and then go ahead with your question, because sometimes we know usernames aren't necessarily reflective of actual names. So we want to know who you are, where you live, and then fire away with your question, and we will try to answer as many as we can. Liz, do we have any questions this week?
I'm not seeing, we had a couple trickled over once Dr. Sim left for him specifically, but I don't see anything regarding our Q&A portion as of right now.
All right. Well, I figured it would be a pretty light one since there was not much to report from session this week. So as we're moving forward, just wanted to share sort of what we're looking at in the Senate. We still have a few supplementals to pass budget-wise. There is still billions of dollars in federal funding between ARP dollars and, coming soon, the bipartisan infrastructure bill dollars that will be coming down to the state. So we'll have a lot more information to share and on bills that we will be passing once session gets up. So I will do last call for questions if you have any more. And if you had any questions for Dr. Sim, I'm sure we will pass them on to Beaumont and get them answered via email. So if you do have a question that you weren't able to get answered in our earlier segment, feel free to either drop it in the chat or email us, and we will make sure to get that question answered. Last call. Any questions? Questions? All right. No questions. We're keeping it light to start out the new year. Liz, did you make any New Year's resolutions? I didn't prep. I was going to ask you this question.
No, that's good. One thing I'd like to do is increase the money in my savings account and become more fiscally responsible. So that's my resolution.
That's a good one. As somebody who graduated from college into the recession, that is something I wish I had done a lot sooner than I did. So my New Year's resolution this year, I wanted to mentally be prepared for all of the change and stress and all of the things that we know kind of come at us. So I wanted to keep my New Year's resolutions, I would say, realistic and attainable. So my resolution was to wear sunscreen every day. So
Nice.
I have been testing out. I put a question out on Twitter to see what sunscreens people like that don't feel super cakey on your face every day. So I'm trying a few of them out. So that's my goal for this year is just to wear sunscreen every day.
Yeah, as one pale person to another, I should also do that. I do it
Yeah.
in the summer more, but not so much in the winter. But
Well,
I'll
you
do
know, the
better.
reflection off the snow is still a very real. And Senator Winnie Brinks gave me advice. She actually had skin cancer right here.
Oh, goodness.
So that was something she was like, don't forget your neck.
Yeah.
Everybody gets their face, but it's kind of, if you're walking around, especially those of us who knock on a lot of doors, this area is particularly vulnerable.
Yeah.
So relatable New Year's resolutions are realistic ones. So with that, Liz, I'll see you next time.
Bye-bye.
All right. Well, thanks everybody for joining us for our first This Week with Mallory of the year. We are going to try to have a lot more guests on. I do think it's valuable to bring experts from the community or from the state to talk to you and share information. So if there's anything you want to learn about, if there's anybody you want to hear from, let us know and we'll try to get them to come on. And with that, we hope you have a great weekend, a great week, and we will see you next time.